Good morning, everyone. I'm Commissioner Bobby Daniel. Thank you so much for being here today. It's just wonderful to look out and see so many of our friends and valued partners to make this a reality. And our Mesa County Behavioral Health could not be here today without our community involvement. And each and every one of you led a huge collaborative effort to get to this point, and we're just so excited to be having our grand opening today. So thank you for being here. This means so much to our community, and we value each and every one of you.
When we did the assessment of our behavioral health system here in Mesa County, what rose to the top is that we had individuals who were cycling in and out of our jail and in and out of our hospitals. And they didn't have a medical need per se, and they weren't criminally minded. They just had untreated behavioral health issues. And so it was decided we would start a intensive case management program for these individuals. And Lisa wrote and was awarded a grant from the BHA for $400,000. We immediately sat down with Brian Johnson with St. Mary's and our sheriff, Todd Rao, to talk about how we would roll it out. And Brian Johnson said, I think this is a great program. It's going to be successful, but it's too small. And I want to put $300,000 into the pot. And he no sooner finished saying that, and the sheriff said, I agree, and I want to put $300,000 in the pot as well. So in literally 3 minutes, we went from $400,000 to $1 million, because that's the Mesa County way. We were very excited about that. And about the same time, Meg Taylor with Rocky Mountain Health Plans called and said, if you had $750,000 for crisis, what would you do? So I turned to Lisa, what would we do? And she drafted a great plan that included a big piece of standing up co-response for Mesa County. We gave that plan to them, they funded us, and so literally we would not have the programs in this building if it weren't for our partners, St. Mary's Intermountain Health, Rocky Mountain Health Plans, and the sheriff. So we're excited to have them here today.
I've been in law enforcement for 38 years, and over that time, very rarely do we get a chance to make an impact before a problem starts. And that's what this is. We sat down with our community partners and we identified behavioral health as the next big problem that law enforcement's going to face. And working with Lisa, the county commissioners, and all our community partners, we are now able to do that. We have dedicated resources that are going to impact those suffering from mental health issues before they end up in our jails, in our justice system. And that's the impact we are going to see over the next 10, 15, 20 years. So it's rare that I get to look in front of everybody and say, we are doing something special. So thank you all for being here. Thank you, Lisa Mills. Thank you, Commissioner Rowland. I don't know where you went. But your leadership in this has been wonderful. Without you, this would not have happened. I hope you know that.
And our mission at St. Mary's Hospital has been and continues to be a call to reveal and foster God's healing love to the people and the communities we serve, especially those who are poor and vulnerable. And certainly we can all agree that the definition of poor is more than financial. It's also referring to those who are poor in health, poor in spirit, and at St. Mary's we know that while the physical health is vital, mental health is essential, and we prioritize both. We appreciate the collaboration approach the MAC program takes to help our communities most vulnerable. It's an innovative way to bring stakeholders together for the common good. The common good is reached when we work together to improve the well-being of the people in our society. The rights of the individual and personal possessions and community resources must be balanced with the needs of the disadvantaged. St. Mary's and Intermountain Health are proud to support this county-wide effort. It takes a village, and by working together, we can help people live their healthiest lives possible.
I just wanted to take a moment to acknowledge the Mesa County way, as Janet called it, which is we start off with problems and we look for solutions to problems. And here, this was a problem of kind of the super users of our services. But one of the things that the Mesa County way does is that it looks, how do we make this the next step? And not just solve problems, but actually do something that's going to make our community healthier and better. And this is a huge commitment. And I just wanted to take a moment to thank the board for their commitment to this and the hospitals, because again, the Mesa County way is for everybody to get together, and this really recognizes that we are trying to do everything we can to make this a much safer, healthier community. So thank you, everybody. And with that, I will turn it over to Meredith.
Well, thank you. Thank you for allowing me to come here and speak. I appreciate that. Barron Associates and the local contractors here appreciate the work. Thank you. And not for self-performing. We greatly appreciate it and keeping it local. The other thing is, we're under budget. That's a big deal. I like that. And I got to really put a special effort out here to Mark. Our superintendent did this. He takes these projects to heart. Thank you, Mark.